Hey everyone, my name is Nico, and as of right now for my capstone, I want to look into the stress of healthcare workers. I want to do this because my career goal is to go into the healthcare industry. So I'm hoping with this research, I can help decide what I want to do and maybe even others. And maybe at the most extremes, hospitals could use this information to see how they can make our healthcare system even better. So like any job that deals with life and death situations, you'd assume that would be a really high stress situation. You'd expect this high level of stress from other jobs like firefighters and police officers because they deal with high levels of stress daily as well. So obviously a lot of this stress would have to come through dealing with these high stressful situations, life and death. But I want to know what specifically causes these stress. Does it come from the patients? Does it come from the colleagues, the management, or even the stress comes from the workers themselves? And I want to see what this stress does for efficiency and the quality of work done by the workers. So I've naturally been doing research about this topic, and from an article I read on a study done by Yuku Fujimura, Hideki Tanji, Koyo Fuma Sanji, these are for Japanese hospitals. They compared hospitals with a 7-to-1 and a 10-to-1 nurse-to-patient ratio. And they found the difference between these two work environments were actually very minimal. If you look, we have these graphs here. They just kind of show some of the differences between you've got the physicians on one side and the nurses on the other side, and then it's the 7-to-1 to the 10-to-1. And you can see some of the differences, and this is just focuses on pay and those kind of things. This graph shows a little bit more about what I'm actually wanting to look into. It talks about the stress of the workload, physical stress and mental stress and all the different effects on the physicians and the nurses. And again, it compares the 1 to 7 to the 1 to 10, the left and the right, as well as physicians and nurses. So this kind of shows that there is a difference in stress level within the healthcare industry, but I also want to look into, compared to other industries and stuff, and see if the stress is that bad, or that effectful, and really if it really does anything, or if it's like a healthy amount of stress and a normal amount of stress. So I want to compare it to different industries, such as just, not really an industry, but college students going about their college life, because they have a lot of things to deal with. So what the average level of a college student stress is. So if you guys could just think about what stresses you out, where the stress comes from. If you think it's like self-inflicted stress, it comes from maybe your parents, your friends, the other students you have classes with, and come to class with some ideas on that, and will be what we'll be able to discuss. And so yeah, thank you. I'll see you guys in class.